Hello, welcome everyone to Americans for Limited Government live stream. I'm very happy today to introduce to you Dr. Teryn Clarke. Now, Dr. Clarke is on as a guest today to share with us her insights and her expertise into this issue of the Biden administration attempting to ration people's access to life-saving COVID treatments. Some of you may have heard of this term monoclonal antibodies. Those have proven to be very effective in treating people who have already gotten COVID. And the Biden administration in recent weeks has tried to limit supplies of this treatment to states that aren't what they say are, fully complying or don't have high enough vaccination rates or aren't mandating masks. Whatever it is the Biden administration is dictating that week, they're saying if you're not living by our dictates, you're not going to have full access to this treatment. So welcome, Dr. Clarke. I really appreciate your joining us and your insights. So what can you tell us about this monoclonal antibodies? Who's getting it and how effective is it? How does it work?
Well, thank you for having me. Monoclonal antibodies have been really a game changer in treating COVID as an outpatient and preventing hospitalizations. So the monoclonal antibodies are an infusion that we can offer outside of the hospital. Generally, they're not offered inside of the hospital, but they've been shown in studies to decrease hospitalizations and severe cases of COVID by up to 70%. So they're very effective. It's a 30-minute infusion, and I've had patients who say they can feel that they're already turning the corner as they're finishing up that 30-minute infusion. It's that dramatic. So it's really a fantastic tool in treating COVID, people with COVID-19.
So you've actually then treated patients with this, and what's happening then? Why is the federal government limiting some states' access to it? What's that all about?
Well, at first, when we heard that some of the infusion clinics that were very busy weren't able to get more, it was because HHS was limiting the supply. And so we thought, well, there might be a shortage because so many of us were using it. We're having wonderful results and our patients are doing well and staying out of the hospital. But in doctors speaking with the manufacturer, there isn't any limit. There's no short supply. So it doesn't need to be rationed. It needs to go wherever doctors and infusion centers are ordering it. Wherever the need is where it needs to be sent. There's no indication that it needs to be rationed.
So is this something then, Dr. Clarke, that you think perhaps needs to be addressed with some sort of legislation? We know that Senator Marco Rubio of Florida has been very concerned about this issue because he has a high percentage of elderly in his state, people who are vulnerable to COVID. And he was one of the states, his state was targeted. They reduced the supplies of this treatment to Florida. So he is really taking the lead in Congress in trying to find a legislative solution. And later this week, he is set to introduce legislation called the TREAT Act. And what this would do is it would allow hospitals to contract directly with the manufacturers of these medicines and bypass the Biden administration's sort of chokehold on them. Is this something that you think would be an effective approach that Congress may need to step in?
Certainly, I would have thought, I've never seen the limitation on therapeutics that we're seeing during this pandemic. So this is really new for physicians. We're not used to not having access to all the tools we want to use from the toolbox. And truly, this is one that, all physicians, this has emergency use authorization from the FDA for use in COVID-19. So all physicians are in agreement that it's helpful. The Assistant Secretary of HHS, Dr. Rachel Levine, is recommending that physicians refer their patients for monoclonal antibodies. So it's not controversial like some of the other medications. It actually is emergency authorized for COVID. So it's not controversial. It's something that saves patients. I'll tell you, just in the last 3 weeks, I've treated a couple patients that come to mind that had monoclonal antibodies. One was a 60-year-old gentleman with leukemia. We treated him with monoclonal antibodies. He had COVID-19. He had double pneumonia. He didn't ever have to go to the hospital. He's recovered now. I also had an 85-year-old woman who with diabetes who's also obese, and we're able to treat her with monoclonal antibodies and keep her home out of the hospital and let her recover at home. So, for our hospital system, it's very important that we have access to this. And if the only way we can guarantee that patients have access to this is through legislation, then we really need that legislation.
Well, I appreciate that. And one of the other things that you have noted is that about a week ago, when Senator DeSantis in Florida held a news conference to announce that, hey, there is a problem here and we need to take action, he noted that it sort of varies by county. Each county in Florida has slightly different numbers, but roughly about 40% of the people in each county in Florida who were being treated with this antibody treatment, they had already gotten the COVID vaccine. So that is sort of an insight into what is the Biden administration trying to do. If they're trying to incentivize people to get the vaccine rather than to seek treatments, the two things don't really make sense, right? When you have about 40% of the people who had already gotten the vaccine who were then being treated. I mean, can you speak to that issue?
Well, that's correct. We're seeing a lot of breakthrough infections, and we're trying to keep everybody out of the hospital and let them recover as quickly as they can at home. We are seeing a lot of breakthrough infections, and people who are vaccinated respond just as well to the monoclonal antibodies as people who aren't vaccinated do respond. So, I don't know if it's trying to punish certain states because of behaviors or attitudes they don't like. For example, Florida, their seniors are highly vaccinated. I think they're at 90 or 95% of their seniors are vaccinated. So to punish the seniors in that location by not having access to this life-saving treatment, it's, as a physician, it's very hard. We don't give care based on people's behaviors. We treat everybody the same, and we need this in our toolbox so we can save lives.
So I appreciate your message because I think it really goes along with what we're trying to get people to do here, which is to take action. You can go to getliberty.org, and right there on the homepage, there's one click. You can click on the Stop Rationing Our Healthcare, and you can send an email to your senators and to your congressmen and urge them to support the TREAT Act. That is Senator Marco Rubio's new legislation. He's expected to introduce it later this week, perhaps as early as tomorrow. And that is legislation that would allow local hospitals around the country to contract directly with the manufacturer of these COVID treatments in order to get supplies. Because we've been told by these manufacturers that there is no shortage of these treatments, but it is being rationed by the Biden administration in some sort of weird attempt to sort of punish Republican or red states that don't abide by all of Biden's dictates. It's a very weird situation, but it appears that we need legislation to address it. So if you could go to getliberty.org, you can very quickly send an email to your senators and your congressmen asking them to support the TREAT Act. And I think that Senator Rubio does need to hear from you. Your local senator needs to hear from you, and your congressman, that you are concerned about big government getting in between you and your health care. And I want to thank so much Dr. Clarke, who was on today. Dr. Clarke is a neurologist. She has been treating patients for COVID with these treatments, the monoclonal antibodies. They've proven to be very effective. Is there anything else you want to say, Dr. Clarke, that maybe I haven't asked you about or that's important for people to know?
As long as people, I have a moment, I just want to be sure that people are aware of these treatments. If you get COVID, there is treatment. There's even a government website where you can find a local infusion center. Talk to your doctor about this treatment. It's life-saving. It turns people around so quickly. So please spread the word about this treatment if your doctor hasn't heard of it or if you hadn't heard of it previously.
Thank you. And one thing I want to make sure, I think you mentioned this earlier, but I want to make sure people are aware that this monoclonal antibodies treatment, it is authorized under emergency use by the FDA. And even you had here, you told me earlier, a doctor from HHS is urging hospitals to use this. So this isn't just something that well, it's not like it's a one-off. I mean, this has been well vetted. The federal government has shown that it's proven. They are asking doctors to use it. Do you want to just address that real quickly?
Yeah, this is the only proven and approved treatment for early COVID, meaning outpatient COVID. It's actually not approved to be given in the hospital. It has to be given outpatient before people need oxygen. So usually in infusion clinics and hospitals' offices, sometimes outpatient infusion centers at hospitals, but not once people are inpatient. So this is an approved therapy. It works, and we need to keep our access to it so we can save our patients' lives.
Thank you so much, Dr. Clarke. We appreciate your expertise and your time today. So thank you, everyone, for watching. And please go to getliberty.org and send a note, an email to your senators and your congressmen and let them know that you support the TREAT Act and you would like them to co-sponsor this legislation. Thank you again. We'll see you next time on an ALG live stream.